And welcome, and thank you for coming to this meeting of Adults Select Committee. Strictly speaking, this is an Adult Select Committee meeting to which, at a later point in the agenda, members of Children and Young People Select Committee have also been invited. My understanding is, though, that there won't be any change of personnel in that. Some of us are already members of that committee and so will be available to wear two hats under that item. That means, therefore, Nicola, that there are no apologies, is that right? I would observe that we are almost all here, and I'm grateful for that, but there are no apologies. Before we go into the main business, I would just like, because we are streaming, to ask people to identify themselves. You don't need to do a short sketch. It's not what's my line. Just sort of say who you are and if you wish to say what your role is. Later in the proceedings, witnesses currently in the public gallery will join us and we will introduce them at the appropriate time. But I don't think the cameras will go in your direction at the moment. So can we begin then with members identifying themselves? Martin, would you like to start and then we'll just go along the rows?
Thank you, Chair. Yes, I'm Martin Hickman, member for Llanfoes Fawr.
Pauline Watts, member for Caldicot Castle.
Delia Hudson, a co-opted member. I'm chairman of the Abergavenny Action 50+.
David Hill, I'm a co-opted member. I'm secretary of Action 50+ Monmouth.
Ralph Chapman, member for Mardy.
County Councillor Ruth Edwards, elected member for Llantilio Cresceni.
Penny Jones, member for Raglan, member of this adult committee and chair of CYP.
Alan Wintle, member for Drybridge Ward in Monmouth.
Councillor Jeff Burrows, Cabinet Member for Social Services for Adults and Children's.
Roger Harris, Vice Chair and Member for Crescent Ward. Excuse my voice.
Mary's and chair of this committee, and grateful for the signal that my microphone wasn't on.
Hazel Eilert, Scrutiny Manager.
Nicola Perry, Democratic Services Officer.
Could we ask the officers to identify themselves as well, please? I'm sorry that we don't seem to run to nameplates for you today, but Julie, would you like to?
Julie Boothroyd, Head of Adult Services.
Eve Parkinson, Integrated Services Manager for North Monmouthshire.
Ailsa McBain, Integrated Service Manager for South Monmouthshire.
Thank you very much indeed. Since Julie and Ailsa are here, can I take the opportunity publicly to thank you for your contributions to yesterday's excellent seminar on safeguarding older people. In our discussion before we started, members noted that was really in large part, I think, instigated by this committee and at the request of this committee. And we don't want to go into details here, but to thank you for it. It was an excellent seminar, and I think we need to think about opportunities for more members to take the chance to hear what we heard and to engage in the issues as we did. But just to note that was a follow-through from a previous meeting, and I, for one, and I think all those who were there, were very appreciative, and thank you very much. Declarations of interest is our next item. Are there any declarations of interest to make at this stage? As and when would seem to be the way forward as usual on this. We'll do that. Thank you. I then have to ask you to confirm and sign the minutes of our meeting held on the 9th of September, which already seems an awful long time ago. So I'll go through for accuracy, if I may, beginning with the first page. And have we got the attendance right? And then go on to the content. Any questions of accuracy on the first page? If you remember, this was the one where we talked about the stroke service redesign as our first major item. Page 2. Page 3. Page 4. Page 5. Page 6. I'll sign that then at the end, Nicola. Thank you very much indeed. We now then move to our substantive agenda for today, public open forum. I'm not aware that there are members of the public in the strict sense here today. Nobody has signalled their wish to speak to us, but we do have guests in the public gallery who will be joining us for a later item on the agenda, and as I said earlier, we will introduce you at the appropriate time. So we come to agenda item 5, presentation on the Gwent Frailty Programme, and Julie Boothroyd is going to speak to us about this. I would ask members to note that Julie is undertaking this, and we're very grateful to her, but not all your questions will necessarily be answerable in the first instance today. They may be. We'll see how we go. But we note that the Health Board, who we did invite to join us for this, have declined to take the opportunity up despite a lot of negotiating of possible dates. I won't go into the details as to why that has happened. It's not an unfamiliar circumstance, but I can say that in the new year we will be joined by Judith Paget, the Chief Executive, and others from the Health Board, and that will be an opportunity for some of the issues that I know members will want to raise to bring up at that point, in addition to the agendaed items. So, Julie, I'm very grateful to you. We are in your hands.
Thank you. Good morning. You have been sent around a couple of presentations, one that's entitled Cordis Bright and one that is on the screen at the moment. The Cordis Bright presentation is, if you like, it's on the back of the frailty report that was commissioned through Cordis Bright, the consultants. We are now, are we 3 years? Yeah. We are 3 years in, yes. And that review was commissioned to actually look at how far Gwent Frailty Programme has progressed and to what extent it has met its original outcomes. Now, I'm not proposing, because otherwise we might end up in death by PowerPoint, I'm not proposing to go through the Cordis Bright presentation, which was given to both the Joint Committee and to the Operational Coordinating Group. What Eve and Elsa have prepared is, if you like, our response from a Monmouthshire perspective to that, so that actually we can knit and weave it into what we're delivering here, which I think makes more sense. But we've given it to you for reference. Clearly, a lot of the outcomes that are, the recommendations that are being presented in that we have reflected upon and are looking at how we operationalise that in the Monmouthshire context. Interestingly, this morning, very early this morning, in fact, I received some updated data on the back of the review, which is going to be going to Welsh Government to substantiate the position of the Gwent Frailty Programme, to establish, have we actually managed to cost avoid, have we managed to save money on the invest to save investment, and to what extent is the data supporting the approach. I plan to actually share that with you. I could share it with you now, but it's very detailed, lots of graphs and lots of bar graphs. What I'm proposing, if it's okay with Peter and members, is to send it round with the minutes, because it actually will add to what we're going to be talking about today. But it's fair to say that my very early reading of that this morning, we've just had another squint now, it puts Monmouthshire in a very, very favourable position. And that's obviously from a Gwent Frailty perspective, but also from the integrated platform on which we deliver our adult social care. And I think it's very useful data that sort of, there's been lots of ambiguity, I think, through the 3 years about, well, is it, has it, at what level is it impacting? And we've certainly been and spoken to you about our experience in terms of stories and the impact on individuals, but this is actual data that is actually being measured across the Gwent Frailty Programme and wider. One of the interesting tables, which of course you will see when we send it around, is the comparison across all the health board footprints in Wales, and it puts ABHB in a very strong position, particularly around the integrated, the Frailty Programme. So I just thought I'd add that in so that you've got that as a context, but we will, like I said, I literally received it very early this morning. It's been work in progress for some time. I'm going to hand over to Eve and Ailsa, who are going to take you through the presentation that will pick up those recommendations that Cordis Bright, if you like, put out to the whole programme. And obviously we'd like you to ask questions of us, and we'll answer all of those questions as we go. Eve?
Okay, thank you. As Julie said, looking at the Cordis Bright review, the recommendations that are made from that are from an overarching perspective. So what we thought would be more useful would be to look at it from what does it actually mean for Monmouthshire. And as you know, we've been working very sort of hard over the last few years around integration. And what the primary recommendation that comes out from the Cordis Bright review is that we adopt a means of integrating across the board. Sorry, I'm looking a bit blank because this is not the presentation that I've just done.
Oh, is it not?
No.
Because you updated it?
Yes, yes.
Can you work from this, or do you need the updated one? Can we do that, or is that not?
Sorry, everybody.
Are we able to?
Can we go with what we've got? I'm sorry that.
Okay.
Otherwise we take a sort of technical break, and I think it's better just. Sorry about that.
That's all right.
This is what members will have seen anyway.
Okay. So the first recommendations are looking at sort of outcomes and adopting means to sort of provide that evidence. But what it primarily talks about is working towards further integration. So what we've done in Monmouthshire is we're already at that place. So the first recommendation in the Cordis Bright review is that we further integrate our community services in all of the boroughs. So rather than having frailty as a standalone service, which it is in the other areas, we look at how our community services are developed. So as you know, we've already done that in Monmouthshire. So that first recommendation is something that we've already, in a way, completed, and we've gone the next step forward, further. And as you know, in Monmouthshire, we're concentrating very much on having an integrated assessment for people. So that assessment is used by all the staff in the community. So that's the social workers, the therapists, and recently the community nurses and the nurses on the wards at both Monavale and Chepstow are also using that same assessment. Whereas in other areas, they'll have a frailty assessment and a district nurse assessment, a community OT assessment, and they're all very different and also all completed very differently. And that assessment is based on what matters to that individual, and I think that's a key feature that will come out later in the presentation. The second recommendation is about strengthening leadership, and primarily they've picked out that by strengthening leadership you'll improve outcomes for service users, you'll avoid admission and early discharge, and start to demonstrate real savings. Now in Monmouthshire we've already developed what we call our FISH system, which FISH stands for Finding Individual Solutions Here. And we've also worked very hard on developing a pull model across both of the acute hospitals. So instead of having the acute hospitals referring people out into the community, we actually send our community staff into the hospitals to find our own people to pull them out. Now, one of the predominant reasons that we do that is because we already know them in the community. So when somebody goes into an acute hospital admission, they're going to people who are, hopefully there to improve their health, medical status, etc. But from a story of their journey, it's the people in the community that know those people best. It's their GPs, it's the social workers that have been involved with them for several years. It's the therapists that know their house, know their family, know their dog. All that is very rich history, which is part of that person's life. Again, we've talked about the integrated assessment, but we've also worked very hard on developing personal outcomes for people. So rather than having very transactional outcomes, for example, how many people did this, how many people did that, how many are independent, ours have been personal outcomes in having a conversation with somebody that says what's important to you today and what's important in your life, from the premise that if we get that right, people's health and well-being actually improve as a result of that. But also we've been working hard on creating sustainability from a community perspective. We know that the community is not just about frailty or just about primary care. It's about the whole of the community. It's about carers, it's about people, it's about inclusion, it's about responsibility. And everybody within that community plays a part in that, not just the public sector or the statutory services. Recommendation 3 is about this named person, i.e., having this leader has responsibility for achieving the outcomes on the previous slide, and clarity on the dashboard about having reliable data to demonstrate progress. Now, one of the issues that we have around integration, of course, is that we struggle then to provide data which is frailty-only data, because we can't extricate that little bit of the business from the whole integrated service. So although we have referrals that come in via frailty, we also have referrals that come in from all sources, from everywhere. We have people coming in to our integrated hubs, we have people phoning in, we have carers, we have public, whereas the frailty SPA only receives referrals from professional people. So it's a tiny bit of our business from an integrated service, so it makes it very difficult to count. What we can provide are the service improvements that are obvious, and Julie just alluded to some of those in Monmouthshire. So when you look at the bigger picture, you can see how well Monmouthshire is doing around some of those things. Some of the other recommendations that have come up, and I haven't filled in all of this table because there's too much to write in it really, is the one that we've already talked about, is that frailty is the start point for further integration. We're already years ahead of that, in all honesty. One of the recommendations is that we have a medical model across all of the boroughs. What we would like to start having conversations about is, again, having a medical model that's integrated with the other services that we have across Monmouthshire. So rather than having a frailty consultant, as they do in the other boroughs, that only deal with what's going on with regard to frailty, we would rather look at a medical model that looked at everything across Monmouthshire. So if we had a consultant, which is actually something that a lot of the GPs would like to have access to a consultant for some of those very complex cases, for some of those that need very thorough assessments, or even for advice and support around managing some of those people. But what we'd like to start having a conversation about is that consultant could also be then responsible or have some responsibility for our community beds. So rather than having a frailty consultant who just does that bit in the community and links in with acute, they also have responsibility for the community beds that we have in Chepstow and in Monavale. So that again we start to have that seamless continuity around the medical bit, and they could then link in very directly with the GPs. I think we're very lucky in Monmouthshire, or maybe it's not luck, but our GPs are very keen to be part of this. They see the responsibility of their patients as being theirs. And again, they're the people that have been involved with them for a long time, so they know about them. Another recommendation was a consistent service across other areas, across all the areas. Well, that's something that we can't really achieve because we've already gone so far ahead. So to be consistent with the other boroughs would be a significant step back for us. a common frailty assessment.
That's so good. I'd like. Do you mind saying that again?
And it's been filmed.
Oh, and I'm being sorry.
To be consistent with the other boroughs would mean a step backward for us. We will. To be consistent is a step backward. We will note that, I think. Thank you. Thank you.
We'll underline that one. Referral criteria, again, you know, they want to look at consistent referral criteria so that people have to fit certain things to be eligible to come into frailty. I suppose with our fish model, we've gone in the opposite direction, as in we don't really have any criteria. You know, anybody can come into the fish system. Now, that doesn't mean that we've developed a system where everybody is sort of accepted and given services. That means we've created a system where everybody can talk to us. So everybody can have access to us for support, advice, signposting, to establish what that person needs, where they could get those needs met. Is it us or is it not us? And anybody who is basically aged over 18 can come into our service and have a conversation with a nurse, a therapist, a social worker. And we don't want to go down that route where you have to be this bad to come into our door, because we're trying to develop the opposite service. A common frailty assessment is another recommendation. I know I sound very negative about some of the recommendations. It's not really that that we're negative about them. It's just that they don't all fit with what we're doing because we're in a very different place. So last year the Minister asked that we develop an integrated assessment across health and social care, which we have done, and we were, actually already doing in Monmouthshire. And as I've said, we've taken that integrated assessment and we're using it across the board. And instead of having that very, very complex assessment that asks what you can't do and what do we need to help you with, it's completely turned around to that, what matters. It's a very proportionate assessment. You can put in lots of detail for complexity, etc., or it can be a very small assessment if that's what somebody needs. But the basic premise of the assessment is what's important to you as a person. So of course we are obliged to meet somebody's needs around meal preparation, helping them get washed and dressed, etc. But that doesn't constitute a life. What constitutes a life is being able to do things every day that are important to you. The next recommendation was, interestingly, this was to adopt a case-finding approach. So that's looking at people who are very complicated and then trying to come up with a strategy to deal with them. What I didn't quite understand was that we've already been doing that with our GPs because it's one of the QOFs. So it's already one of their quality indicators. So we've been working with our GPs across Monmouthshire to look at who are people that we need to have a plan around to help them stay at home as healthy as possible and prevent them going into hospital. Triage in the spa. This is about putting a fairly highly qualified person in the spa, which is a single point of access for frailty where all the referrals go, so that they can have a conversation with the professional to look at where it needs to go and what needs to happen to it, whether it's eligible for frailty, whether it's not eligible for frailty. Well, of course, that works in the opposite way to how we've developed fish, because we've developed fish as in, please just phone us, have a conversation with us, and we then can make the decision because we can ask the right question. But also we've got that wealth of history from all the nurses, all the therapists, all the social workers to be able to make, you know, the right decisions, give the right advice, or make sure that it goes to the right person. Embed an IT system. So the frailty use a very specific IT system, which is again a standalone system from any of the other systems that are used in the other boroughs or in health. In Monmouthshire, we've actually been working very hard and we've developed an IT system that we are now using across all our staff, whether they're in health or social care. So we're in the early stages. It's not been without its pain, but we're hoping next year to go live with a fully integrated system that everybody has access to and can input to in Monmouthshire. So a frailty IT system is another system that we have to serve. and the information on there isn't accessible to everybody else. So anybody who has been in frailty and then goes into another bit of the service, they can't see what's happened to them, you know, what sort of interventions they had, etc. So the way we see the current situation is that frailty is a standalone team within community services. There are integrated services, so that's where we are or have been, and that's a community service that's integrating with like-for-like groups across health and social care. We like to see that we're now going towards a whole systems integration where all our services wrap around individuals, and that's around the whole systems from the community themselves, the third sector, the statutory services, and all that fits in with what the bill's asking us to do. As we've said already, how do you access us? We've got staff in the fishbowl every day. They don't look like that. They are there to take calls, but they're also there to go out. So, you know, if somebody phones up, they ask questions, they think this sounds like it's fairly dire at home, things don't look good, they will say on the phone there and then, I'll be there within 10 minutes, I'll be there within half an hour. So they go out and visit there and then. People can come in via the SPA portal, public, professionals, walk in via the GP. They can come in anyway, phone, email, text, you name it, we'll take it really. Just a bit on fish. We did a little bit of a follow-up on how people found the experience of going through the fishbowl. And we looked at, we selected randomly 34 people, 10 we weren't able to contact in the time that we looked at, and we phoned them up. In fact, admin staff phoned them up, so there was no, you know, background or context to what was going on. And overall, people were unbelievably happy that it was easy to get through. You know, we're still in a situation where staff answer the phone and the person on the other end of the phone can't actually believe that they're speaking to the right person there and then, without going, where do you live, who's your GP, blah, blah, yes, or press 1, press 2, or giving all this information to somebody who you know is just collecting it and then going to hand it on to someone else. And the sort of things that people said were, you know, they were over the moon with the service. It was brilliant. The girl even drew me a map. Fabulous response. Really pleased. Can get a good night's sleep for once. You know, and that's the sort of thing that we want people. We want it to be easy to get into our system. Whoever you are, whatever you are, and whatever's going on at that moment in time in your life. There's good and bad. Some of the cons are that, as we've said, counting what we do and what frailty want us to count is virtually impossible for us, because we can't count what we do from an integrated service perspective. We can count the little bits of frailty, but we have to try and tease those out, because once that referral comes through the portal, it's handed on to the integrated team. So we haven't got a frailty OT and a frailty nurse. We've got a team of OTs and a team of nurses who then do everything. You know, so if you looked at nurses, for example, in the other boroughs, there'll be people who are seen by a district nurse because of their diabetes or an ulcer or, you know, whatever. They'll be seen by another nurse for end of life. They'll be seen by a frailty nurse if they're having IVs, whereas the nurses in our team would do everything. So a person who's having a crisis or needs intervention hasn't got a whole range of strangers going in and out. And I heard from a patient that had been admitted to Neville Hall recently with a fall. She had early dementia. She was quite confused. She was very sort of disorientated on the ward. And the nurses said, oh, you know, the OT's coming to see you later. And she couldn't believe that the OT that came in to see her was the same OT that had been working with her for 6 weeks when she was at home. And I don't think you can underestimate how that important is, not to have to start all over again. But also that seeing a familiar face with somebody who knows you, like I said, knows that you've got a dog, knows your daughter lives in Devon, knows, but it's very reassuring. And those things are actually very important to help people get onto the road to recovery. Organisational constraints is definitely a con. You know, we have to put I'm being filmed, but we have to put an Iron Bevan on the table in there. It's very difficult working in integrated service with two organisations who work in quite different ways. And I think we feel that restraint from not just from the frailty aspect, but the Iron Bevan aspect of it. And we all know there's a lot of emphasis on the acute hospitals. I'll send round, I'll give and send the newer presentation I did, because one of the slides in that says that, and why I did it again was because things change every day. You know, a presentation that I did a week ago is already, you know, has elements of old information in it. So I was trying to be savvy, but there we go. But it shows that in Monmouthshire, on a day-to-day basis, we are usually helping and supporting about 3,000 people every day. So that's home care, nurses, therapists, social workers. That's not including our residential care beds. And we have, in the acute hospitals, around 150. You know, and so it's just about, you know, we get that constant pull into the acute. We've got people who need to be discharged, which is really, really important. But we're also keeping a very big show on the road in the community as well. I think sustainability is an issue for us because we just grow and grow. And we struggle with sustainability and staffing, particularly if we've got people absent for any reason. You know, at the moment, it almost seems to go in trends. You know, this year's fashionable trend is maternity leave. So we've got half our therapists are off on maternity leave, but it has a huge impact on running the service and managing to keep things going. The positives about what we do are there are no handoffs, and by that we mean people don't get referred from one bit of the business to another bit of business to another bit of the business, because we are it. There is no one else to hand it on to. When a referral's come into our team, it's dealt with by that team because, you know, there isn't any other options. As a result of that, we've got no duplication of information, and our failure, as in things that come in that we don't get right the first time, goes down because you know, the emphasis is on getting the right person there. You know, nurses will go out to see someone and they'll phone back to base and go, actually, I really need an OT here. Mrs. Jones is stuck in the chair. 5 minutes later, the OT's on the road out to it. So they don't have to fill in a referral, then it goes on a waiting list, and then we wait for whoever it's going to be allocated to. They're part of the same team. As we've said, it fits the bill. I've put there fewer detox, like it's, you know, I think that the information that Julie sends around later will show this. I think the delayed transfers of care that we have in Monmouthshire are probably, they're tiny. So I think in September we're like 2. And usually they're for some really unusual reason, like there's something legal going on or somebody needs a very, very complex adaptations or something like that. Whereas in the other boroughs, they're in their 10s, 50s, you know, so with 2 in September. And that's not unusual, that's the norm. In fact, we've had some months where we've had none whatsoever. And people take ownership of what we're doing, the staff, you know, staff. And staff went up to one of the other boroughs to talk about what we were doing, and they couldn't believe. And they said we'd actually forgotten how it used to be, where they were wading through bureaucracy and trying to find someone to help them. So staff, you know, enjoy working in the service, but also the people that we see and we talk to, we have a very enabling approach, as in, you know, helping people to help themselves. So it's not just about us creating dependency on the services, it's about people also, you know, becoming more independent. And we are very, very efficient. Oh, here we go, 3,000 people every day, compared to just over 100 in the acute hospitals. And the impact that we have is, you know, budgets have been reducing, residential beds have been reducing, detox are very, very small. Reablement, the impact on outcomes, personal outcomes for people is significant, but also outcomes on longer term care packages, how many people are then dependent on having people coming in to help them at home. With packages of care and waiting lists. You know, we don't have any waiting lists to speak of most of the time. You know, we occasionally will have, you know, we'll go in and say, you know, people will say, we've got 8 on the waiting list for, you know, smaller things like stair rails and things like that. If you go to some of the other boroughs, they've got hundreds. I know one of the other boroughs, the waiting list is over a year, whereas we don't have any waiting lists at all. We've talked about delayed transfers of care. And then just a little bit about the future. You know, when we talked about that slide about whole systems integration, you know, we're working very hard on things like trying to contribute to and develop sustainable communities, reduce dependency on statutory services. So that's, you know, from our mind, that's not about withdrawing, but that's about, you know, the only sort of thing we were able to do at one point was give somebody Meals on Wheels, give somebody a package of care, and that's not always what people want to do. You know, people want to live a life, so our job is to help them to do that, not to be dependent on us. We're there if we're needed, but if we can get somebody back on their feet or the community helping them to regain some of that independence, then that's what we would do. And things like the Raglan project, which I'm sure most of you will have heard of, is an amazing project that we hope to replicate that model and that ethos across all our services. And then I thought of a couple of others, which I can't remember. Workforce planning is another area, and developing further partnerships, particularly with third sector. Add anything? That's it.
Fantastic.
What?
I was just going to get you to turn your button.
Thank you.
Thank you very much, Eve. Are you going to say things to us, or do we take questions now? What's going to be the best thing, I think? Right. Thank you very much for that. I'm sorry that we didn't let you use the later version, but we will get that. And thank you. So, Councillor Penny-Jones.
Thank you. That was an excellent report. Just one thing. Where is this fishbowl and how many staff are in there? Because we don't know.
The fish bowls, we've got one in each of the hubs. So that's one in Chepstow, one in Monmouth and one in Abergavenny. It's always manned by a therapist or a member of the therapy staff and a member of the social work staff. And on the whole, people do it on a rota basis, so they take turns being in the fish bowl. And we have access to the nurses because they're, you know, based in the hubs at the same time, so they can be called upon as and when they're needed. One of them always stays there to answer the phone, and the other one can go out on, you know, calls where there's an urgent need or an urgent nature there and then.
Thank you very much. It was excellent. And I think everybody here feels they'll stay in Monmouthshire because when they get the need, that they will be well looked after, because it comes across almost like we're the children as we get older. They say you go back to your childhood and you've got mother looking after you, because it does come across just like that, that there is somebody that's going to look after your needs to get you going again, pick you up off the floor and put the plaster on, and then you're okay. And it really does come across like that, that there is somebody that does care. So it was a brilliant presentation, and thank you very much.
More questions from members. Councillor Wintle, I'd certainly like to bring Jeff in a moment, if I may. Alan.
Well, I've only got one question, really, and it's this is so good, it's fantastic. Why isn't the rest of bloody Wales using it?
I mean, obviously, I think there's a little bit of context here as to why isn't the rest of Wales using it. There are parts of England that are using similar integrated approaches, and certainly a lot of the stuff that we've read through the King's Fund, where people are wanting to, particularly around health, wanting to look at what's the impact and the opportunity for integrating further. I think this is why when we were asked to do the frailty word feels very old to us now, because actually we were already integrated and on a pathway before frailty came in. Frailty has been absorbed into what we do, and I think that's come across very well today. And the integrated way in which we deliver services is the right way to go. On a regional level, I think we've been able to influence very strongly the direction of travel. And in the beginning, people were very much, oh, Monmouthshire, they're just doing their own thing, and, you know, they're being awkward, or whatever, you know, being awkward. Actually now, certainly Blaen y Gwent and, which is the other, Torfaen, are beginning to look at how they integrate, particularly their nursing service. And certainly Blaen y Gwent have taken an opportunity where they've needed to co-locate their provision and said, this is our opportunity. And you do need an opportunity to do it. It isn't one of those things that you can do from one day to the next. We probably have a 10 or more year history with this piece of work. Our partnership with the Health Board, our joint work that we've done with the Health Board has led us to be in the place where we've had the opportunity to do this. If we were starting today and thinking, right, we want to do it, I think it would take quite a few years. I'm saying 10 in my head, but it would take quite a while to do. You do need what we call the system conditions in place, and we're very fortunate in Monmouthshire. We've got, you know, proactive leadership. We've got the conditions that are out. We've got members who are supportive of this approach. So we've been able to take this very, very far forwards. And whenever we've been asked to speak, and we've spoken at lots of different places about how we've done what we've done, we always reflect that 10-year journey and say, and the conditions that we have in order to make this happen. And you need all of that. So the simple answer is, I think it's hard to do, and hence why not everybody does it and don't have the conditions within which to do it.
Yes, but so the rest of Wales really has got the opportunity. Why you reinvent the wheel? This is working. It's fantastic. They're complaining they got no money. You know, this is saving, you know, thousands, millions. I can't. Well, I know they're a bunch of idiots, but anyway. It's fantastic, and I just can't believe that they're not.
Yeah, thank you, Chair. And in response to your point, Alan, I think really what this is all really truly about, when you say about mandating other parts of the Principality to kind of do it the same way as we do. I mean, what we're talking about here is effective integrated work really only comes about when you've got willing collaboration. And the one thing that we have here in the Gwent area is a very good collaborative spirit with the other authorities, but most importantly with the health service that we work with as well regionally. So when you have those things all going together, then you've got a chance. So to try and impose that kind of willingness on other areas of Wales where, frankly, there isn't that relationship, is in my respect going to be a really hard struggle. I think the other thing I just really wanted to share with you was that obviously it was some of the points I've listened to some great interest, because obviously being the chair of the Gwent for LT Joint Committee, I have to kind of take a slightly more of a perspective on it, because obviously I've got the responsibility of the other authorities within the project. But I do find it's a very warm feeling sometimes every time Monmouthshire comes up, and I'm trying not to sound biased, but it is great what we've really achieved. It's absolutely fantastic. A couple of points really just to kind of give it a little bit of context. I mean, one thing that is seen is particularly from Welsh Government, that integrated working is the only truly effective way of actually doing and combining social care and health, and any way they can promote that and through the things we're doing is very important. So at some stage it may well be that the 5 authorities and health will actually become a much larger integrated board, where it will be taking on integrated services, the governance of that, of which Frailty will be just one. So the reason why Cordis Bright felt that there needed to be another kind of aspect of leadership and have a named individual to come along and actually be almost like kind of the chief executive of Frailty, to actually be known for that. And it really, to some degree, actually reinforces the points that were coming out in the staff conference for those who were able to attend, where you've got leadership and aspiration and strategy and all the rest of it, and then you ask the question of the people actually at the sharp end, well, do you get it too? And they say, well, no, because we don't really feel the same kind of leadership links, and we don't understand. And I think to some degree, you know, we've always got to be mindful that we have great ideas, but we've got to be really truly effective in ensuring those values do actually transcend throughout the organisation, throughout the integrated practices, to ensure that everyone is on message and everyone really understands the values. The other thing I really just wanted to kind of share with you is that there is a slight shift in the direction of travel with Frailty, in the sense that when it was first set up, this was seen as a way to effectively try and find ways of reducing acute beds and actually find ways of actually managing more in the community. What has happened, of course, is in the intervening 3 years, is that life has actually turned out to be quite different for that, because the one thing that perhaps frankly, a little bit naively, wasn't really factored in so much was the kind of the degree of demographic change, particularly that which we're seeing in this part of Wales in terms of demand. So what's happened is that we haven't gone through a period where lots of money has been saved as a consequence of fewer people in hospital. What we're doing is plateauing demand and managing demand so that things are kind of flatlining and slightly declining, where the need is actually going up. So it's gone from a cost-saving exercise to really to a cost avoidance. One of the upshots of that, therefore, is that we've got in Frailty the context of actually having all this investor save money to actually get this thing pump primed and started. You know, who's going to pay it all back? Well, we feel that there is another way forward with that, and there is going to be conversations with Welsh Government about whether or not that will actually be paid back, because it's so very important that we've got to find a way of maintaining viability, because we're all getting reduced budgets. We just don't have the money to do this. But what is actually coming out, and what is so timely and great about the data that we're now seeing, because it has been a while coming, it is actually showing the value of what we're doing in these soft the soft edges of this, where it's very difficult to quantify in money and resource terms what has been achieved. But having whole loads of fantastic stories about outcomes, about being truly the right way to do it, and now finally we're starting to get some hard-edged data that's reinforcing that, I think puts us in a very good position. So that's just a little bit of a context I just wanted to add.
Thank you very much, Jeff. Any more questions from members before we draw this item to a close and some conclusions? Councillor Edwards.
Right. Thank you, Chair. Yes, it's all
Penny
very
and then
positive,
Dave.
and continuity is always the best road to go down with any sort of service, I think. But do you find it at all more challenging, because after all it's rather a rural county this is, and is there more of a pressure on resources for travel and the availability of people having to drive, whoever going to go out, or cars available when they need them? Is that an issue at all in the programme?
Well, the short answer is yes. I mean, we obviously try and coordinate our work, but also because of the fact that we have integrated services, that has created some capacity in that, whereas once upon a time you might have had, you know, a nurse going out and then a social worker going out and then a therapist going out. Of course, because now we have a more integrated way of working, and we are trying to encourage a more generalist sort of perspective, as in, you know, nurses can go out and they'll deliver some low-level equipment and things like that to reduce some of that repetition. So I think we've created, you know, some capacity from that. You know, the stuff that we talked about around sustainable communities is part of that, but also the Raglan model, where we look at having more locality based services, I think is the next direction that we're going to be sort of going in, where we start looking at areas in Monmouthshire where we could replicate that sort of model, so you almost have a team that wraps themselves around that bit of the community. So that's another way that we might look at dealing with that. But yeah, and I think that comes hand in hand with that is the fact that, you know, we have a lot of people who are out of reach and very isolated, and that's a key thing that we know that we have to keep at the top of our agenda, is how do we make sure those people stay included and part of the community. Do you want to add to that?
Yeah. Can I just add, it's a much wider context, but it's again, the direction of travel, and everything we talk about is always about improvement, moving forward. It never stands still. Part of what we have at the moment in our domiciliary care framework is what is known as a framework agreement, and we have, you know, moved from many providers to smaller providers. That contract is up in next year. And we are doing some very concentrated work at the moment that's looking at the locality concept of purchasing for the future, very much based on the Raglan approach. Almost the way that we're describing it is a bit like a patchwork quilt approach, which actually it won't be one size fits all. It will be around communities. And now that's a big ask in terms of how you design a new system around that. But we're up for it because this work teaches us, if you like, that's the way we've got to go. So we've got to try and find a solution to that. Just wanted to put that on the radar, really.
Penny Jones and then David Hill, please.
Yes, you've really touched on it, Julie, now, but I just want to say that I champion the Raglan project tremendously and visit them when I can, and I really can't support it enough. But I hear now that it's going to be rolled out to Usk and Monmouth. And I just wondered, does this mean now that more staff are going to be made full-time as a result of this? And is it being used as an exemplar by other areas? You did say you had visitors. Is that specifically for the Raglan project?
No, we have visitors for all aspects.
For the integration?
Yeah.
Okay, thank you.
If I just explain what's happening with the Raglan project, just very briefly, yes, we've got agreement to go ahead, and potentially at the moment we're talking between 14 and 17 clusters, which is quite a big. That's how it's looking in terms of its mapping. They're doing lots of work at the moment to understand that. Just interestingly, I'm the chair of, it might not be interesting to you, but it's to me, I'm the chair of the All Wales Adults Heads of Service Group, and I took an opportunity recently to take two of the Raglan staff, along with the manager, up to the forum to actually engage in a debate around frameworks for domiciliary care for the future. And those of you, and Penny has met them, have met those individuals, they sell what it is about. I mean, you don't have to, and people were bowled over. But again, we're in that place which was, how do we get that? How do we embed that in as an approach? I'm very pleased that we're going to really be trying to embed that as an approach, however complex and difficult it will be. But it will mean that people will be on full-time contracted hours. We've got to create the conditions within this care sector that supports the delivery of what we want as outcomes for people. We can't do it for no money, you know. And actually our learning is consistently it's either the same or less cost. It's not more cost, and the outcomes are better. So it sort of works out, really.
Thank you. Could I just say one thing? A report by the UK government the other day actually emphasised the success of this type of care, stating that it saves such a lot of money in the long term. And I think you can actually see it for yourselves when you see people. Thank you.
David? Thank you, Penny.
I was just going to say that, you know, when you see this presented as it is at the moment and the situation that it's got to, and, you know, how well it is going, that, you know, we owe a lot of thanks to the people who are here, but also having been come to some extent involved from Clinical Futures onwards. You know, like Julie was saying, I mean, it's taken many years along quite a rocky road, actually, to get to what you're looking at now. You know, and I think to these people here and to others before them, like sort of Kate Crosby and Anne Rollings and things, there is, you know, there's a lot of thanks to be given, because it wasn't an easy road to travel, but it, you know, the results are beginning to come forward now, and I think we should all accept that it wasn't an easy road, and that's why other people don't find it an easy road.
Thank you, David. Well, shall we draw this item then to a conclusion? And conclusion that we might wish to draw might go something like this. First of all, I think I would like to thank our presenters who've given us some very detailed and very positive insights into a programme that we have already taken an interest in and are very sympathetic to. So I think we want to record our continuing recognition of what is being achieved and to wish for further progress. And that brings me to the next bit, which is slightly more awkward. I was briefly depressed during the earlier part of the presentation because along the following lines, here we are doing some marvellous stuff in the name of a programme which is actually possibly holding us back. And so maybe the recommendation from this committee is not only to keep going, but to, along the way, because we haven't got much else to do, reorganise health and social care while we're at it. Because that, seriously, is what actually we're talking about. We're talking about nothing less than, it's a perennial question, I know, the Holy Grail. How do we better engineer or re-engineer the health and social care interface in order to deliver the outcomes that people really need and want? And that's too big a challenge for this committee. But I think it is a way of saying that we recognise that when Jeff goes forward to chair the board, when Julie and her team go forward in various ways to engage with this programme, they're actually not just looking at how a particular piece of very important local work is moving. They're actually at the cutting edge of how health and social care work together. And the more we can encourage others to learn from and attempt the same journey, the better. As you say, in the best sense, there's nothing new in this, but it's always the fate of innovators to wonder why everybody else is so slow. And I just hope, and I really do hope, and I've said this before, whatever we think about the outcomes of local government reorganisation, if it happens, we will all be let down if this good work gets lost and sidetracked and taken back into, well, I might be exaggerating if I say the dark ages, because that's what it feels like. So the more people who can be persuaded to come and talk and listen and be encouraged and received, I mean, I think dialogue, meeting, talking, visiting is a far more effective, and taking people out with you, as you've done with colleagues from Raglan, that's a far more potent way of disseminating than producing academic papers on their own. So those would be the kind of conclusions I would hope we would be able to draw. Are members content with that? And so thank you to the team. Thank you, Jeff, for coming and adding to our understanding, and at the same token demonstrating once again your commitment and support to the work. I would suggest that we take anybody else who's getting missed out from the plaudits, please go. I suppose the Director of Social Services has some small part in this as well. But in all seriousness, now I'd like us to take a short break, but before we do that, while we've still got Julie here, members did ask earlier for an update on a particular issue at Mardy Park. Julie, could you enlighten us, please?
Peter had a little word with me before. There was some concern being expressed about Mardy being shut, as opposed to, I thought he said it's going to be closed. I said, well, that's news to me. There's a current norovirus infection at the moment, and obviously the safeguards are in place that mean that actually we want to try and not have traffic in and out. We certainly don't want more staff going down with it. We've got a lot of staff who have been infected with it. It's one of those seasonal times that it means that we have to put some safeguards in place. So I'm not sure where it had come from, but that's the current issue at the moment, and it will then reopen obviously for traffic when that's clear and safe.
Julie, thank you very much. Maureen, would you like to come in on this one, please?
Thank you, Chairman. I just wanted to ask whether this is going to affect Open Day, which is it's going to be postponed, is it again?
I'm not aware that it is going to be postponed yet.
No,
the 29th is the open day, so I mean it just depends on how soon it clears up. But hopefully we will be able to progress. Hopefully.
Thank you.
So before we take a adjournment, can I use this opportunity just to share some thoughts? And I think they reflect things that members were saying before we started the formal part of the meeting. So there's no really thought through detail here. It's just some things that we might like to think about, and particularly perhaps we could ask Simon and Julie to sort of take away. I think there is a sense that sometimes elected members, sometimes for good but not always for good reason, kind of don't know what's going on, or feel they don't know what's going on would be more accurate. And I just wonder whether we could consider some sort of almost alert system, some sort of rapid communication approach, that when an issue of this sort, and there will be plenty of others, comes up, members aren't kind of wrong-footed when they're in their community or get the phone call from the reporter. I don't want to exaggerate this, but at the same time, I'm sure members who are very positively disposed in any case towards the things that we're concerned with in this committee would actually be able to help if their understanding and knowledge could be increased. Now, I'm not asking for something hugely complicated or detailed, and I realise there are resource constraints, but it has been pointed out. We also, as members are on a journey of discovery, really, rather than being regularly informed. We do learn that there is a new communications specialist in the authority. Some of us have met her, actually think that there may be a role for her, at least to talk with colleagues and see if we can get some way of addressing this issue. When I was in Welsh Government, I used to get weekly, if not more often, regular updates from the likes of WHO and so on. I mean, I was getting figures on Ebola years ago, and I used to think, why am I hearing this? But I now know why I was. It was part of the overall context in which policy was being developed and implemented. And it's the same here, I think. In a local way, it could be very, very useful. So if we could just ask Simon and Julie perhaps to give that a bit of thought. I'm sure we can pursue it in detail elsewhere. I think, have I got the message clear? It's a sort of alert system, isn't it, really? But it answers the basic question, can we help ourselves to better understand and more quickly what's going on? And in the past, we've had very quick news about, say, 1 or 2 episodes in care homes, not even in the authority. But that's another one that we might want to think about as well. I will say no more. I will ask us to take a short break. How long should we go? 3 minutes, while Matthew comes in to make his presentation. You're all very welcome to gets ready for his presentation. Sorry, you're all welcome to stay, but you've probably got better things to do. Thank you very much indeed. Shall we start?
She must have
Shall
been
we start?
asleep.
Shall we reconvene, please? Thank you. I don't know. Shall we reconvene? Thank
So
you.
everything you've said.
It's always the bit that goes on off camera that you want to hear, isn't it? Now, once again, welcome Matthew Gatehouse, who's going to take us through his report. So we're on item 6 of the agenda, report on Q2 performance improvement objective and outcome agreements. And you've got the main document, but I think Matt will want to say a few things to us to take us into it. And thank you very much. Ready when you are.
Thank you very much, Chair. So some of the things to talk about really now are more exciting developments in the world of social services, really. Perhaps masked by the title of performance report, but don't let that deceive you. But before I move on to that, I want to start with an apology, which is within the numbering of the report, which is the report you will see moves paragraph 3.7, 3.8, 3.9, and back to 3.6. Entirely human error on my part caused by end of day and editing 2 reports fairly swiftly together. Interestingly, the last 3 paragraphs in that report form part of a cabinet report, which will be going in a couple of weeks' time, but are actually incredibly useful in context around this meeting, actually. So if I start with that apology, and when I come on to that point, I'll actually sort of talk around those a little, if I may, with the Chair's permission, because I think they are very useful context for the committee. So the report before you today is on 2 areas of performance, but largely on the same sorts of issues. So it's reporting to you on the improvement objective, which you as councillors set back as part of our improvement plan in May. And that's focused predominantly on the work around community coordination. The second element of the report is focused on our outcome agreement with Welsh Government. Members will be aware that the outcome agreement with Welsh Government is something which we jointly agree targets on with our colleagues in Cyteus Park and Cardiff Bay. And it works across 5 themes, and if we're successful in meeting the targets against those 5 themes, we receive funding in the region of £840,000 per year, which is built into our base budget. So it's a fairly important area to ensure scrutiny of, because obviously the risks, should we underperform in any of these areas and fail to secure that money, are significant in terms of the knock-on effect for how we would deal with that loss of revenue. The outcome agreement is slightly broader than the improvement objective. So the improvement objectives focuses predominantly on community coordination. So the outcome agreement focuses on community coordination. The improvement objective also brings in a safeguarding element. Now, predominantly sitting within the remit of children and young people select, but actually in the context it fits within this particular improvement objective, which is scrutinised by Adult Select. It's sat here for information, but it is predominantly scrutinised by children and young people select. And the information on safeguarding, they've scrutinised as part of a report which Jane Rogers took to the last Children and Young People Select Committee meeting. So to start with a bit of a headline, really, progress against both the improvement objective and outcome agreement is on track. So as far as this particular element of the outcome agreement goes, and there are 5 themes within it, our internal assessment is that we're on course. So what that means is if we continue on that track in the 2015-16 financial year, community coordination is contributing its bit to the outcome agreement for the whole authority. Broadly speaking, in terms of sort of progress against that, again, some of this is going to be very familiar to members, so I won't choose to dwell on it too much, but would be happy to take any questions. And I know similarly, sort of with Julie sat to my right, there'll be areas which, with the Chair's permission, she may expand on. But the pilots now in Abergavenny and Caldecott for community coordination are up and running. So just to remind members, this is where we place coordinators in communities really to avoid drawing people into statutory services, what my colleague Nikki Neal describes as a gravitational pull into statutory services, that people contact us, we assess them, and they get drawn into a service. And in a worst case example around that, what we end up doing is sort of picking people up from their very local community, putting them on a bus, taking them to one of our towns to attend a day centre, for example, rather than working to build connections with their neighbours, their people in their immediate locality, which are more sustainable relationships. So we've got communicators now working in Abergavenny and Caldecott who are starting to build those relationships and establish the networks in the local areas. And I think in terms of the people they're supporting, there's a sort of number later on in the report, around sort of 43 people at the end of September was the number which they were actively supporting. Now the contacts relationships were in excess of that. When I spoke to Ash Morgan, who's one of the coordinator for Abergavenny, Ash personally had been working, indirectly with over 100 people. But when you look at actually that higher end work, the sort of people that may have been touching our services were it not for community coordination, there were sort of 43 of those individuals. The other element to the work is small local enterprises. So we have a small local enterprise coordinator in place now who is working across the whole of the county, and that's working with existing small local enterprises to try and strengthen them, to make them part of a stronger network where they can learn from each other and where Sarah can put them in touch with other professionals, be it sort of financial or legal advice, that sort of support they need when you're in the early days of developing an enterprise. And through small local enterprises to support people to help themselves and help others in their community. And also, there are links from that into some of the work in Enterprise Directorate around developing a more enterprising culture. Overall, in terms of outcome, it's too early to report huge impact. This is really, again, something which is sort of fairly innovative and transformative in its nature, similarly to the work around Gwent Frailty, which was received earlier. What we can say is the impact of community coordination on the key performance indicators we've put against it is positive, that they're moving in the right direction, that we are seeing less people coming through to receive statutory packages of social care, which is in line with our targets. We're starting to see some indication of cost avoidance. So typically, someone that comes into adult services costs around £9,000 per year for that package of care to keep them independent. At the earlier stage, the sort of people community coordinators work with, it's about £3,000 to £3,500. But by building more sustainable relationships in the community and building mutual support networks, what we hope to do is minimise those new packages of care in the system. So not only are people having better outcomes because they're having sustainable relationships, but actually we're not incurring expenditure from actually probably what we may see as not the best outcome for people. So we are starting to see some evidence coming through of cost avoidance, which the business case was founded on. Not that this would save money. It won't save money because the population demographics we have are significant and probably unsustainable without the sort of transformation that colleagues in social services are undertaking. But that those additional people, that demographic pressure, and I think it's probably well reported that we expect to see a sort of doubling of the over 85 population in the next 15 to 20 years. This is about sustainable social care support for people in communities. It's very early days. The anecdotal evidence and the case study evidence coming from the coordinators is positive. The indications, what we're seeing in terms of the bottom line, is that it's starting to have the success, the impact we expect of it. There's a learning and evaluation framework in place around this, and it's overseen by a leadership group of which Julie sits on, but but which is drawn from a group of people from the other professional groups as well. So the NHS are on that group, the housing associations, Gwent Police. So collectively they oversee the learning from this project. And as this work progresses over time, I think probably not only through in its context of the outcome agreement and improvement objectives, but Julie, Nikki and colleagues will be bringing further updates to allow you as members to scrutinise the outcome of that work. So Chair, with your permission, can I sort of pause at that point?
That's very helpful. Questions, colleagues? Delia.
The community coordinators
The community coordinators were appointed in April, and I understand it was a one-year contract, in which case they're well past halfway through. It wasn't a one-year contract, was it not?
No, the first coordinator was appointed in April.
Yes.
The second and the small local enterprise coordinator were appointed in June, but they're actually 2-year contracts.
Right.
So we have 2 years, and that was around really. This we accept is fairly cutting-edge work.
Mm-hmm.
So by putting it on a time-limited basis, it allows officers and members to fully evaluate the impact of that rather than putting costs into something which would be long-term. And that's why we've put the learning and evaluation framework alongside that, to actually understand really on a week-by-week basis what's working, what isn't working, to have the greatest chance of success in that period. But the business case is on expanding at the point of success from 2 to 4 coordinators to take that to scale. But the point at which that's done is really based on the evaluation and the work of the first coordinators.
So you can see that they might well be going on a permanent basis.
Too early to tell at the moment. We are hopeful, and we're building a platform, certainly through the leadership group, that opens up the conversation that says, how would we continue to invest? And one of the early learnings is actually we're recognising that there's lots of duplication. So third sector, independent sector, other providers of even, the housing association, people have got similar type aspects to their roles in these agencies and in these organisations. And having those partners around the table is really, really useful, because our original premise was, if this is successful, how do we have a leadership group that can contribute the finance to keep this going? Our up-to-date thinking is, how do we collaborate with everybody else to ensure that we potentially look towards developing locality team approach to this community coordination approach as well. So we're actively looking at the learning from that, and those stakeholders and partners that are part of the leadership group are all part and parcel of that conversation as this develops. So I think it's too early to say. Hope it's going to be it's proving to be successful. Hope it continues to be, but actually sustaining the funding and what model that will be in the future, we need to wait and see. Yeah.
Thank you. Thank you.
Any more questions? Penny, Councillor Penny Jones.
Thank you. On page 7 of your report, page 16 of the bundle, you talk about a safeguarding, but in relation to children. I just wondered why there's no mention of adult safeguarding, which we all know is an important issue with vulnerable adults.
Yes, I suppose, in terms of the responsibilities around safeguarding, as a directorate, that's responsibility across both children's and adults. And in terms of probably how sort of the improvement objective is constructed, it does cover that whole range. And of course, members will be aware there was a seminar yesterday on the subject. Predominantly, the focus of this has been around some of the recommendations coming out of the Estin Inspectorate and the extent to which colleagues are contributing to that agenda by putting in place effective policies and ensuring that information comes through that enables kind of proper oversight and learning from the work in safeguarding. So I think actually it's a very valid challenge. And actually later on, it's not agenda, but it's there for information. We brought forward the report card around the protection of vulnerable adults for information for members, to actually ensure that fuller range on the adult side is there for members to consider.
So I think I would agree with Councillor Jones on this one, that partly because our awareness has been raised only as recently as yesterday, it's a bit unfair then to say to you, well, why wasn't it here all along? But it is a serious point that safeguarding isn't just an issue for children and young people. And I think some of us yesterday were, how can I put it, surprised by the range of some of our responsibilities in this area, which we weren't perhaps as clear about as we might have been, but for the fact that we had a very good event yesterday that Julie and colleagues, internal and external, helped us to focus on. So further down the track, this is the kind of thing that we might want to see more explicit, I think, if that's possible. I'm sorry I'm holding you up, Maureen. I know you want to come in.
I just really, what I'm trying to say really is that perhaps it could have been mentioned there rather than even explained, but adults could be mentioned in the context of safeguarding, because too many people think it's just about children. That was all I was trying to get at.
Absolutely, and I think that's a very fair point, and we'll reflect that the next time the report comes before members.
So if we could make sure that we recorded that, obviously the precise form that will take will need to be worked up, but we would want it to be a clearer reference to safeguarding, including vulnerable adults, and there's all the POVA work as well, which is otherwise unacknowledged here. Councillor Powell.
Thank you, Chairman. Sadly, I couldn't be here yesterday because I was already booked for another meeting many weeks before. Going along that line, I mean, I think safeguarding of adults is something that is very important, particularly where you get elderly people who aren't able to go to their homes, aren't able to come into the hubs. They're being looked after at home, sometimes if they're lucky with a series of visits during the day, 3 or 4 visits during the day. But and hopefully they'll always be looked after in the correct way. But I think one of the worries is sometimes somebody will employ somebody privately to come in and see to them, and we haven't got any control over that elderly person because it's out of our scheme, and I don't know how that can be supervised in any way because it is out of the scheme. But there are elderly people, we hear of it in the news, that have been abused, they've been very vulnerable, and things go wrong, and I don't know if there's any way in which we can look at that.
Thank you for that question. I think, again, one of the things that we talked about yesterday was the breadth and complexity of work with adults. And obviously adults who have capacity and make decisions that may be the right decisions can sometimes, become the victims of people who are perhaps not as upstanding as we'd like them to be. I think one of the directions of travel for us is about enabling, empowering, and giving people more information about what is possible. And one of the things I think that was played out yesterday was the breadth of potential for abuse and for people to be subject to abuse. And actually part of the working direction that we want to go in is not only responding to when it happens, but actually trying to raise awareness so that people can actually help protect themselves and have some of those safeguards around them themselves. And that's a bigger piece of work, but something that we're very keen to progress, and it would pull in those people that you're talking about, actually enabling people to make sure that they are safeguarded and that they can protect themselves.
Thank you very much. Because with regards with children, obviously that seems to be our first priority. I've been to so many safeguarding seminars as a governor about children, and it does go out of your mind. You tend to think not to think about the elderly people, but getting older myself, I'm starting to think about it. Thank you.
Heaven forbid. Can I ask a question and make a point? Sorry. I'm fascinated that the community coordination pilots seem to be coming along nicely, and I'm very pleased to hear what you said about small local enterprises. I just want to sound a note of warning that across the council, we tend to have developing projects of innovative ways of working, but they're not kind of evenly distributed. And so, you know, if you live, for example, in Chepstow, you might wonder why there's no community coordination going on the social services side. That is readily visible. You know, My Place is also running in Abergavenny and Caldecott, and I'm sure that that was probably part of the thinking. But we just need to be careful that we don't have, I won't say a two-speed county, but we remember that ways of doing things are actually changing quite markedly in some places and not yet others. Just a caution, really. Sorry, I'm sure I stopped somebody asking a much more sensible question there. Did I? Okay.
Can I ask?
Roger.
Thank you, Chair. Matthew, on page 17 of the bundle, page 8 of your report, you've got figures along the top line, for example, 212, 213 actual, and you've got 214, 215 actual, and that implies, to my mind, if the earlier ones are what the year outcome was, that 214, 15 figures are finished. Would it be better there just to have 214, 215 to date?
Yes, absolutely, Councillor Harris, and again, apologies that isn't clear. I'll ensure that in future, again, that reflects that position and does for future committees when they receive their version of the report.
One of the things that we've just been reflecting on here is around a similar page, isn't it? The business about bed blocking. And, I mean, we know that that is an issue of national concern. Even the Daily Mail acknowledges it today, apparently. And I know this is essentially based on what's happening with NHS in England, but it is very much a timely consideration. What's the headline? Bed block crisis stops 1,000 patients every day leaving hospital. Now, that's not necessarily this side of the border. I don't know where those particular figures come from, but the timeliness of some of this, I think, shouldn't escape us. Okay. Any more questions, comments? Do you want to take us on into any?
Yes, Chair, again, with your permission, just then to mention sort of I suppose what came in as the rogue paragraphs in the report, but actually do have an important context, which is the subject of targets and the extent to which not just this committee, but which I suppose as a council as a whole now, in the context of a reducing budget position, we need to look again at what we understand by improvement and continuous improvement. Because as a local authority, we have a duty to work to continuously improve services. Now, actually, in a reducing budget environment, 4.3% reductions next year, we have to look at ourselves and consider what does improvement mean in that context. So whereas I think we're quite used to seeing across the board targets which show a stretch and improvement year on year, in some cases now, as members, and officers may be bringing information in front of you, which is about maintaining performance at a level with reducing resources, which in itself, within the letter of the law, constitutes improvement. Doing the same with less money is improving in the same way that doing more with standstill budget positions or more money is there. And I think probably we've tended, I certainly have, I would say as an officer, we focus on improvement. What we've just appended to this report, and I think in terms of this committee, there isn't a huge amount of discussion required. But what we've seen in some areas of the council business is targets kind of changing through the year. Mm-hmm. It's important now for us, give absolute clarity to members around any target changes, because we're not always looking at absolute performance gains year on year as we have been doing in the past. So it was really just an opportunity to prepare members really that in the months and years to come, we'll start to see some different language coming in around performance and target setting. So the sort of back end of this report is just really sort of restating for members current target positions. Now, the Children and Young People Committee, equivalent to this report, will see a number of changes to targets in there, and that's because of the way in which they work with the Education Achievement Service now and track pupil progress over the year and amend targets through the year. It isn't the case that applies in adults particularly, but nonetheless we felt it was important to bring forward those targets that have been set historically. There is one amendment which, with your permission, I'd make verbally for it to be captured, and that's just there's a performance indicator in there, the number of older adults supported in residential care, which in our improvement plan was set at 230. It's a fairly minor issue, but fairly soon after that needed to be amended to 227, which is simply a case of it being as good as or better than the previous year. So the target was set quite early in the year, then the actual figures are finalised, and so the target was just dropped down by 3 by Simon's Directorate Management team, and we haven't brought that back to committee to confirm that. So in the scheme of things, it's a fairly minor issue. The target is being exceeded, but it's a target now of 227 rather than 230, which was previously part of our improvement plan. A little bit of housekeeping, I suppose.
Okay. Matthew, is there any evidence that you can point us to about how other authorities are actually handling the same? Because it's the same issue, isn't it? You constantly want to improve, but the constraints are as you've described them. Are others facing the same issues, and are they demonstrating any progress that we can learn from?
I think it's too early for us to say really. In terms of my networks and sort of speaking with my equivalents around Wales, people are just getting into that. I think probably we're a little bit ahead of the curve on some of this in Monmouthshire, because we've started, or for a number of years, we believe we've been a fairly lean organisation anyway, and perhaps some of the challenges that we're facing now around performance, being pretty lean as we are, others have not yet come to. It's sometimes described as a case of low-hanging fruit, and I've certainly heard colleagues in other authorities and in other networks talk around decisions that councils are making, which to me don't feel as though they're at the difficult sorts of choices we're having to make. So actually, when you look at things like some of the staffing efficiencies, if you look at, for example, a number of authorities out there still have large amounts of residential homes within the authority. Now in Monmouthshire, we don't manage or run a lot of beds ourselves. There are a lot of people that still have far more in-house home care, whereas as far as possible, we concentrate our in-house home care on high-skill, high-end, reablement and integrated working, where we can really add value. So in a sense, there's nothing I've come across so far, and I wouldn't claim that I've seen all of this, and there are certainly places that we would look to learn from when they become apparent to us.
Any further questions for Matthew? So I guess at this stage we thank you for your report. We have made 1 or 2 suggestions about how further down the track 1 or 2 things could be perhaps given a bit more emphasis. That was particularly to make sure that adult safeguarding isn't invisible. Are members happy then to move on to the next item of business? Thank you very much indeed. You're welcome to stay or go, whichever suits. you want to do that? Are you all right? Yeah, thank you for bearing it. Oh, for this one? Yeah. Margaret, thank you. Well, members, we welcome now to the table Margaret Rooney and Anne Ferris from CSSIW. I understand that Margaret is actually going to be our witness, and Anne, I'm not quite sure what your sort of backup and help if needed. But it would be helpful, I think, to the committee, even though, Margaret, we have met you before, not everybody watching the proceedings will necessarily know you, would be helpful if you could just say a little bit about what you do, and perhaps Anne might like to do the same as well, and then everybody's clear what these important roles are. But it will be Margaret who takes us into the report, and for this item, this is of particular interest to both Adult and Children and Young People Select Committee. And we do, of course, as I've said previously, have representatives here from both.
Thank you, Chair. Thank you, members, for inviting me here today. I hope you can hear me. My voice is a bit croaky because I've got a bit of a cold. My name is Margaret Rooney, and I'm the Regional Director for CSIW for the South East. The reason why there's two of us here today is because I took up this post in March of this year, and prior to that, I was the Area Manager for Monmouthshire. So under normal circumstances, the Area Manager for each area would prepare this report, have the main relationship with the local authority, and present it to Scrutiny or Council. And as I was the main person having those links with local authority last year, it was appropriate that I would write the report and present it. Anne Ferris will be the area manager, well, is now the area manager for Monmouthshire, and therefore that's why Anne is here today. I'm not sure, Anne, if you want to add any more to that.
No, I think you've probably said it all. It's nice for me to be back in Monmouthshire, because I did work in Monmouthshire many moons ago, so it's very nice to be back and actually still see some faces that I knew then, which says something about how long some of us have been around, really.
Thank you, Anne. Members, I don't propose in this presentation to go into the finer details of the report, rather to pick out the key summarised points and the areas of progress, areas for improvement, and then allow members to ask questions which I may answer or perhaps your officers may answer. But in order to give you some background, the report, which is CSIW's annual review and evaluation of performance, forms part of the annual council reporting framework called the ACRF. This is an annual process we go through. The findings and that we present within the report, we come about those findings via using a number of different methodologies throughout the year. And I've set them out here, which include, obviously, which some of you just had a presentation on, performance indicators, so how the local authority performed against those statutory performance indicators. The information that's contained within your directors and indeed your heads of service reports. Indeed, we often visit Scrutiny, come in and sit in the public gallery, listen to the conversations that go on at Scrutiny, look at the minutes that come out of Scrutiny committees, or any other publications. So we would be looking at that throughout the year. But more importantly, we draw these findings from any inspections that we undertake in the local authority during the year, and site visits. Site visits being sort of shorter, smaller visits by the area manager to go and visit services, talk to service users. We'd also draw some information from our regulatory inspections, and that's inspecting regulated services, residential care homes, domiciliary care agencies, your in-house domiciliary care provision. Finding from other regulatory inspectors like WAO or Eston. And we have regular engagement meetings with senior officers on a quarterly basis, and the area manager would also meet with your heads of service quite regularly to sort of get updates and discuss arrangements and performance in social services. So that's sort of information we use to develop the report. But what I would want to notice, this report, you'll notice, is the 2013-14 report. We're now at November. And in many ways, that's a bit unavoidable because it takes time. You know, in April, the director's report comes out in June. We then start putting our information together, write the reports, and it was published in October. So you may find that some of the key findings or areas for improvement that we have noted here, there may be some progress on those that your director, your head of services may be able to report on if you have questions on them. Okay, so if we start, the way I've formulated this presentation is basically, first of all, to look at the overarching summary and then go into summaries in adult services, areas for progress, improvement, and the same for children's. So in terms of overall summary, I think it's fair to say that in Monmouthshire there is certainly, and we've heard some of this morning, there's certainly a clear vision of the shape of social services that's required to meet future demand, to enable people to live independently. And that's all centres around, it's set out in the single integrated plan, and it centres around person-focused services, early intervention, prevention, building community resilience to support people to maintain their independence and avoid or prevent the need for statutory services for as long as possible. So that's sort of the ethos. And when we speak to senior officers and indeed staff during my visits during the year, that is a vision that is understood at all levels within the staff when I've spoken to them. So that's a positive thing. And that direction of travel is in keeping with the principles that are set out within the Social Service and Wellbeing Act. And it's not something, as you've already heard today, I'm very pleased we came for the entire meeting, so it was useful to hear some of the previous reports. It's not something that Monmouthshire just started this year. It's been a journey. It's been a journey that's been on for some time. There's more to do, and I think that's what this third point on this slide is about within the Director's report and from our conversations with staff and our findings. There is an understanding of the areas where performance has to get better. And one of those, for example, in Children's Services, which my colleague has been to visit Children's Service Committee and presented some of the findings we looked after children inspection. But the need to put in place some measures to measure the impact of services. And there is currently and has been work done on that in Monmouthshire in terms of developing the work around developing personal outcomes and getting staff to think about personal outcomes when they're working with people. The introduction of a new ICT system will help collate some of those findings and present you and the public with information about how these services are actually, if and how they are producing outcomes. We saw evidence of that Monmouthshire understands and listens to what people need and want. And that's via, some of the work being taken forward by the systems thinking's work. So when Monmouthshire has restructured services, they've done sort of discrete piece of systems thinking's work. And that systems thinking work has involved speaking to people about what they need from services. Also via surveys and consultations. And certainly when we've spoken to people, they've been quite positive about some of those services. So that's sort of the overarching summaries, but then getting into some of the more finer detail about individual adults or children's. In terms of adult services, when you've heard quite a lot this morning, Monmouthshire does perform well against many of the key performance indicators in adult services. And one that I would pick out in particular is the delayed transfers of care, which you've heard a little bit about this morning. That is where the instances where people are delayed from being discharged from hospital due to services not being available or appropriate adjustments being made at home for them to be able to go home. In Monmouthshire, that indicator was 1.8 per 1,000 population, which really does compare well to the Wales average, which is 4.8 per 1,000 population. And some of that is more than likely due to the remodelling and that journey that Monmouthshire has been on within adult services to support that independence through those development of those integrated teams and the delivery of reablement services. The community coordination is also going to be a key part of that, and as you've heard, some of those posts are now in place. that has taken some time to get in place and get the finances in place to put them in place, but they're there now, and we can see from your outcomes report that those people are now working with people. And that's all part of that vision, and that's quite a positive thing. When we've spoken to people during the year, when I've gone to visit the reablement services, the fish bowls, we went and we spoke to people who were receiving those services. The feedback was exceptionally positive. And during our regulated inspections of the in-house domiciliary care agency, we also went to visit people in their own homes, and they were very positive about the services that they were receiving and the reablement services. I think obviously a key part of that has been the collaboration and the joint work with health services, and that's something that Monmouthshire has been doing well, and that journey continues. There is further plans in place to work closer across the 5 Gwent local authorities and the Health Board, to work with Nairn Brevin Health Board to deliver outcomes for people, older people with complex needs. And there are strategies in place, and my report does mention the strategies on mental health and learning disabilities, which are strategies covering from 2012 to 2017, I believe. Now, progress on those has been slower than perhaps councils would have wanted. However, there is now a pilot in place for the mental health strategy, and we would hope to see some outcomes of that and that being rolled out to other areas. In terms of areas of progress, so last year, in the last year's report, I talked about carers and the importance. Obviously, in order for this journey to continue, you will need, carers are a very important partner in the delivery of those outcomes. And one of the points that was made in last year's report was about ensuring that carers will be identified. Now, this year, figures are showing us that more carers have been identified, and we can tell that by the number of carers that were offered an assessment. And that went up from 322 to 675. So more carers have been identified. However, the percentage of those carers that had an assessment went down, which might be explainable because you had more people who were offered an assessment, and sometimes people don't identify themselves as carers and may not want an assessment. But that journey is one that will need to continue because they are an important partner in delivering what it is you're trying to deliver here. And one of the areas that we were concerned about last year, and when I presented the report to council last year, members were also concerned about, was the proportion of adults who had a care plan reviews, which is very important to ensure that the services being delivered are the right services for the people receiving them. And there was an improvement in that PI this year, performance indicator, from 54% to 82%. And I know from speaking to the head of adult service, there was a concerted effort to do that piece of work, a specific piece of work to look at some of those care plan reviews, and that's shown in the performance. I heard members talking earlier about the Raglan project. I was very interested in the Raglan project throughout the year. I found it sounded like a very innovative project. I heard, like some of you here have heard, the staff working the Raglan project. It certainly sounds like a very positive project, and I went to see a member of the public who's receiving services, and the outcomes for that particular couple were very impressive, and not just for the person who needed the care, but also for the carer, which was very important. I felt was very important. We are really interested to look at that this year to see, as it now rolls out to 2 other areas, to have a further look at the Raglan project. Certainly, it's something that you could be proud of. I guess it's a good piece of work. Again, the integrated health and care teams are continuing to give that good support to people in the community. And an interesting statistic, and I can see it's in your performance report, is that that team is helping people to become as independent as possible. And sometimes those people may continue to need some care, but 50% last year, 51% I see it is today, of people are supposed to be fully independent. And that's quite a good outcome from those integrated teams. Another important development within adult services was the development of the commissioning strategy, which, when you read the 3-year commissioning strategy, is in line with the vision to be person-centred, to concentrate on more collaboration and on outcomes. And I guess one of the big outcomes of all of this work will be for people, but also for one of the conversations you've just had about cost savings. And last year, the council managed its budget well, and in adult services, I think it was actually an underspend. I think it was an underspend last year. So in adult services, the journey is, I would say, is a fairly positive picture. The summary of findings within children's services is probably a bit more mixed. Now, within children's services, there has equally been a journey of restructuring and reshaping services in order to, in line with the vision. So in 2011-12, I hope I got that year correct, there was a restructure of children's services, and the ethos behind that was again about focusing on having the right people at the front door so that they could, when families come for support, they can speak to someone who can give them some support straight away. So that journey is also happening in children's services. However, from our inspection of the LAC services, we found that perhaps the planning behind that may needed to have been a bit more robust, and I think as well there are some pressures in children's services that have had impact. One of those is high numbers of looked after children. That number has remained high. It went up about 2 years ago and it has remained high. And also pressures in social workers meeting the timescales for in court, and that has placed some pressures in children's services. Our inspection there, which I should note was a very focused inspection, focusing on a very particular group of children. Not all looked after children, it was a very specific group of children. Found some areas where we were concerned about risk assessment and care planning, and for that reason we decided to come back and have a broader look at children's services, and that inspection is currently happening. In terms of performance against performance indicators, there were some areas there that we were concerned about, particularly in relation to initial care planning and statutory visits looked after children, where that performance was weaker when you compare it to other local authorities. And they're important performance indicators. Statutory visits in particular are exceptionally important for looked after children in terms of safeguarding. I'm sure your officers will be able to report to you. I haven't got the most recent performance figures in front of me, but your office may be able to report where that has gone, because bear in mind we are now in November of the following year. However, some of the areas that we highlighted in last year's report, there were some improvements, in substantial improvements in fact, in relation to initial assessments and co-group meetings for child protection increased significantly. So that there have been some improvements in some areas of children's services. So the timeliness of those improvements include the timeliness of decision making on referrals in children's services had improved, and the re-referral rate to children's services improved. Now, one of the visits that I undertook myself during the year was to visit the JAF and the TAF, the Team Around the Family, and the Joint Assessment Family Framework, which is a system of working, a sort of a multi-agency system of working, early intervention prevention, where organisations work together to support families to prevent them from requiring more statutory services. So I visited one of the JAF meetings and saw colleagues from education and social services discussing, and third sector, discussing a group of children who, when described, had some quite complex needs, but also had some good outcomes from some of the input that they'd had via the Team Around the Family. One of the things at that time, this was back in January, there were no sort of measures there to measure the impact of that, but one might look at the re-referral rate to children's services, which has improved. It's a bit early to say whether that, so in other words, that the less children are coming back to children's services. It's too early to say whether that's because of the JAF and TAF, but certainly that went down from in around 16% to 13%, which was a good improvement in the re-referral rate. The Gwent Adoption Service came into being in April, but prior to that, Monmouthshire was working with their neighbouring local authorities on their adoption service, and that's an important service which forms part of the National Adoption Service, which is an important development. and the corporate parenting strategy, which is something that I had mentioned in the report, had been mentioned in the ACRF reports for a couple of years prior, was introduced and it's now in place. I visited the corporate parenting group in January and saw them doing some good work around their corporate parenting role and thinking about how they could put in place training programs for members to increase awareness around the corporate parenting their corporate parent responsibilities. So in terms of areas for improvement in children's services, this first area of improvement, I must admit, is probably in every one of our reports across Wales. It is an ongoing issue of services for children, CAMS, child adolescent mental health services for children who've got mental health needs. For example, when I visited the JAF meeting, there were no health colleagues there, and the colleagues that were at the meeting did report difficulties in getting child and adult mental health services. And that's an ongoing issue, and it's something that is not just in this local authority. One of the areas, obviously, that I've included is that the local authority should take action to respond to some of those concerns that were highlighted in the children's inspection. However, I do know that there were plans put in place and some of those plans have been implemented. It's too early for us to say what the impact of those have been. Obviously, the inspection is going on now. We'll be able to have a better view when that inspection is complete and we look at the findings in the round. One of the developments from the previous year was the introduction of the Safeguarding and Quality Assurance Unit. And we know, and I saw evidence that Safeguarding and Quality Assurance Unit has put in place many initiatives to improve the safeguarding within Monmouthshire. For example, the auditing framework, which services use to audit their safeguarding procedures, a large amount of training that has gone on. What this area of improvement is about putting in place some sort of measures that you can measure, well, how we know that we've trained X number of people, how do we know that's had an impact? So it's about putting in place things that can measure the impact of the work that's taken place. The last one here on this slide is very much about really related to some of the findings of the Looked After Children inspection, and I think that's around the restructuring of children's services. When we spoke to some of the staff within children's services, they did talk about feeling pressures in managing priorities of court work, taking referrals, etc. So we recommended that a review of that, of the transfer points within children's service needs to be looked at. And I know that piece of work has been undertaken and there has been some slight amendments to those transfer points, which we would hope has addressed this issue. Again, I've mentioned statutory visits already, that's an area that is an important area in terms of safeguarding children and needs to improve. This next point is really a good point and then maybe slightly an area for improvement, in that in last year's report we and members were very concerned about the rate of reviews for children in need, which was sitting at that point at 19.5%. But that has improved significantly to 57.5%. However, that still is below what the Wales average is, so there's more work to be done there, and perhaps the figures will show there's further improvement there. Personal education plans is an area, and I can't remember what the actual figure on that was, but personal education plans from what I can remember had decreased. The percentage of looked after children who had a personal education plan in place had decreased. And that's an important thing for children, looked after children, in order that their education, that their aspirations for their education can be set out and planned for. Although I should note that education outcomes for looked after children were fairly good in Monmouthshire. The last 2 points, the second last point came from the children's inspection, where it was felt that more needs to be done to increase that awareness and understanding of the vulnerabilities of risks surrounding looked after children. And I think that was some of the work that the corporate parenting group were hoping to take forward in terms of a training plan for members on their corporate parenting responsibilities. And finally, it is to implement the corporate parenting strategy. So now that there is one in place, it would be important to take that forward. And we would hope to see the pace of that to be quicker than the pace was in actually developing it. So I know it's a sort of a whistle-stop tour, but I'm sure members have got lots of questions they would want to ask, and I'm happy to take questions.
Thank you, Margaret. Councillor Powell.
Thank you very much. You mentioned that the Children's Mental Health Service could be improved. How do you see this happening? Of course, there may be many hidden issues in these cases where it isn't recognised as a mental health problem. Sometimes it's they're taught the children just being difficult. But can you see any way that this can be improved and more can be helped?
I think this point in the report is about, it's really about working with colleagues from health in order to ensure that there are more services available. So really, it's for health really to make sure those services, the appropriate services are available, and having those partnership arrangements in place, that those services are in place. So the actual point from the report talks about working with colleagues from health to put those services in place.
Yeah, I was thinking mostly about recognising it and getting them help, whether it's from health or from children's services, that managing to pinpoint these things before they got too difficult. I don't know what the answer is.
Well, I guess I think what you're referring to is how you recognise, you pick it up at an early enough stage. I guess that's about perhaps your early intervention and prevention service. I'm not sure whether your officers might want to say something about that.
Well, I did want to come in, if I may, about this general issue. I mean, I was delighted to see that issue raised in our report, and it's in no sense a criticism of the local authority. It's a serious criticism across Wales, I think, about the priority that at the moment services for children with complex psychological or mental health needs have. So it was more string to our bow, and also you may have noticed recently in the press that the Welsh Government was talking about needing to up the support there. What we experience at the moment in Gwent and in Monmouthshire is a difficulty in getting, not a difficulty in identifying children in need of this type of support, but in actually getting the right support in place. And sometimes that's appropriately done at a lower level and a preventative level. And for example, the face-to-face counselling within the youth service has a role to play. But very quickly, in terms of complexity, you can move beyond what's appropriate for that sort of service to deal with. And that's where we're struggling sometimes to get quick enough responses. I very recently was in correspondence with our MP about an issue where a family had been waiting for 6 months for support. And obviously 6 months is an absolute lifetime if you've got a teenage daughter in this case who is struggling. So what we're doing about this is, in fact, in the last week I've written to an Aaron Bevan about this, and I'm not the only one. But we have now in place, since the last about 6 months, a joint committee for children, rather like the one that we had in place for frailty for some time. And my colleague from Torvine is the chair of that. So I've been passing these particular case issues back to her to have the discussion. I think the response from the professionals involved in mental health for adolescents will be very supportive of the fact that there's pressure coming from ourselves, because it's a question of how we prioritise those services, I think, within the health service. So that's a long way of saying that, although that might appear to be a criticism of Monmouthshire, actually it's raising a crucial issue that I think we all want to move forward on. Thanks.
Thank you, Simon, for that. I think this resonates across a number of other recent meetings. It also resonates back to the discussion of the frailty programme in its wider context, the seemingly inbuilt tendency of the NHS just to be the National Hospital Service, and mental health loses out and community lose out, and this is a very good example of where the service needs more support than and it's not for us to do that, actually, is it? but we need that joint working arrangement. So we wish that well, and we're pleased to note that. Councillor Jones wants to come in, I believe.
Yes, thank you. Thank you for your report. I don't mean this to be a criticism, but this is late feedback of the 13-14 performance report, which you stated at the beginning. And whilst it's helpful, it's not so useful for somebody like me who is going to be involved in your inspection next week and have questions. And we haven't got the up-to-date material. So I was wondering, firstly, will the next report, inspection report, come through earlier, the feedback from it? But also, I have concerns about some issues that we know about. For instance, the staff restructuring has actually changed completely, and I know that staff morale has been raised as a result. You know, this report doesn't indicate that. Also, I have concerns, deep concerns about the need for reviews, the way that you know, we stay below the national average. We may have improved with our reviews, but they're still below the Welsh average. And also statutory visits, and I'd like to know why. But are those the most up-to-date figures? And should I be actually concentrating on those, or should I have more information that's up to date? Thank you.
I can talk to you about the first element, and then I'll pass over to your officers for the update. The reason for the timescales is because the director's report comes out at the end of June, so we are sort of waiting for that to come out, and then there's the writing period, and sort of we come back then to officers to sort of present to them what our key findings are. So there's sort of, I mean, last year, for example, I was standing in your council chamber in January giving this report because we then had to find a date to present it back. So it is quite difficult to squash the timescale. However, I think you do raise an important point about how we can work more closely with you to give you some of this information in a more live way. So we do meet with your officers on a quarterly basis, but certainly I know that we are keen, and this is sort of a common theme, where we want to work more closely with scrutiny and to align more closely with scrutiny. So, for example, we've got plans to have common agendas for engagement meetings across the country, but also to have those the minutes of those meetings available so that you can have scrutiny can look at them. And also we would be happy to, for example, come to scrutiny in year, perhaps not to give a report on this sort of report, but perhaps, for example, to present something about what our findings are in general on regulated services. For example, in children's, we could do something on what we're finding the quality of services in children in early years provision. So there are sort of key pieces of work we probably could do throughout the year that would help you. I can't guarantee that we can squash the timescale on this particular report because it's sort of like a big report drawing it all together. But certainly we'd be keen to work on other aspects. And in terms of your question about the reviews and statutory visits, I'd like to hand you over, Simon, to...
On the statutory visits straight away, I mean, those figures clearly weren't acceptable, and I'm pleased that you picked them up. The children need reviews were reported as 19, then 57. As we speak, they're 95% plus at the moment. And the LAC stats are 81% plus at the moment. The reason I know that is because we're receiving weekly updates on them, and the team have been working enormously hard alongside preparing for an inspection and everything else. But I mean, it will always be the case that there will be a time lag in terms of formal inspections and report writing, and it's good to know that we've got to the level in scrutiny where that doesn't feel good enough, because we want that sort of up-to-date information. We have, of course, got the hub now, which any member can click onto and see pretty much, well, they can see as up-to-date information as I can as Chief Officer, and that is an immensely powerful tool, I think, for anyone in this room to be able to ask just the sort of questions that, Councillor Jones has just asked us. So that's a real step forward, I think, for Monmouthshire. The issue about how we get the feedback from things like inspections quick enough is an important one, I think. You might want to reflect after this meeting, because I know we're being inspected as we speak, but the formal information, I understand we won't be getting until possibly the new year. So that actually starts to build in a time lag, which really almost invalidates some of the conversations we want to have in this room. So we'll perhaps have to think about how we share the verbal feedback and how we get some conversations going very early on, not wait for the report to sort of hit the website. And as I say, it's just it's great to have this sort of conversation, isn't it, where we're being held to account for real-time information and seeing 6 months as being a long time in the life of, in this case, children's services. I don't know, Tracy, whether you want to add anything. It's entirely up to you.
Just to add really that over the summer, taking over in April as I did of the service, it was very clear that the children's services were quite disconnected to what performance indicators meant and what the implication was for us within Monmouthshire, but also in the Wales national context as well. So Matt Gatehouse and I ran a workshop over the summer to just re-evidence the importance of performance indicators. And as Simon's been saying, we've had those key indicators that we monitor weekly. And the good news about those indicators, as you can tell from discussion today, is that they are improving. And that's because staff are doing that work, not because senior officers are doing it, because at the end of the day, it's down to my staff putting the right things in the right place on the system and doing those LAC visits and those stat visits and those reviews. And so the staff are pleased to see as well that they've made those improvements in really quite a short space of time.
Thank you. I think it's helpful, Margaret, for you to make the suggestions that you have done. But I think Simon's right. We do need a bigger conversation outside of here to look at all the various impacts and timings of these reports. From memory, this report came to full council. Is this the same one that you gave us a presentation? And
are you referring to last year's report or Simon's report?
Last year. Right. Anyway, but here's the rub. Particularly if you're involved in Children and Young People's Committee, you get essentially the same stuff poured over by ESTIN, by WAO, and by CSSIW. And my question really is, could there not be some better way of doing things? I mean, I don't know how many times Tracy hasn't been before us, relatively new in post, explaining what she inherited and what she's done, and that's fantastic. And I think we very supportive. But it really is extraordinary that we have to keep mining this same vein so often, and it's all essentially the same stuff. So if we can, now I am not suggesting for 1 minute that these reports aren't needed, but if we've got better access now to real-time information, between us we might be able to find a better way of sharpening up the processes that we're talking about. So, Margaret, you've helped us with a very important point. Simon, you've made a very helpful suggestion, and I'm sure that people would welcome us trying to look at this. Maybe it's just me thinking I've seen things before, but actually I'm convinced I have.
Sorry. Thank you, Chair. My comments have been addressed to a certain extent. I'm the elected member on the fostering panel, and over the years I've been deeply concerned. If you look on page 3, completion of children in needs reviews, that's already been mentioned, and completion of statutory visits, we were miles behind, and it really was worrying, bearing in mind the context of what's happening, for example, in Rotherham and other places. We could have been, in fact, we are, and we should have been vulnerable because we weren't getting there. But it's obvious now from what Simon's just told us, which is the important thing. You know, they've been transformed. They really have, and I think it's important to mention this in public, and anyone listening out there on this broadcast, that things have dramatically improved, and we have a new head of children's services. I'm sure that's part of it. But if we can get important improvements like this out into the public domain more quickly than statutorily they have to be. That is good, and you know, we can use the Children and Young People's Select Committee and Adult Select to make sure that the good news gets out quicker, and also if there's bad news, you know, so that we can do something about it. All right, thank you.
Thank you, Roger. I'm sure we're all thinking along very similar lines here. Are there any, going back to Margaret's presentation and the underpinning documentation, are there any questions that people would like to ask, whether from the Adults Select perspective or from the Children's and Young People's perspective? Each alike has an opportunity, if you wish to take it. So if not, shall we then draw some conclusions? Can we? Thank you, Margaret and Anne, for coming. We must sound really rather ungrateful. I don't think we mean to at all. No, we're all caught up in this huge process that just sometimes needs a little bit of straightening out. So if we record our thanks to you, that we recognise that there are some improvements and continuing needs to improve as expressed in the report, but we are also aware that similar perspectives have been coming from other sources, and this leads us, I think, as a committee to want to, I'm sure I'm speaking for Children and Young People as well, actually, aren't I, Penny? That as two committees which are dealing with these very important issues, we want to look again to see whether we can find improved ways of handling these important external reports, and in some way combining that with making better use of real-time information. That's the sort of direction that I think we should be going in, and I sense agreement from the committees. That takes nothing away from what we've heard this morning, or our appreciation of the valuable work that's described. And once again, our appreciation of the efforts that are being made by the officers leading the services. And I particularly single out Tracy, actually, because she's on such a shorter time scale than some of the others. And every time she comes here, she must think, oh no, not another drubbing. But actually, things are looking up, and we recognise that, and we appreciate that.
Yeah.
Thank you very much. I think we now go back to you for the scorecard, which essentially is for information, but if there were any questions that people wanted to ask or issues they wanted further information on, they could do so if they wished. So you don't need to come to the front. The stocks are closed, but if there are things that people want to pick out from the report card that we've been sent, now is the time to do it.
Sorry, this isn't a detailed question or anything. It was just pointing out or making a comment about the consistency that there seems to be in the approach now, which is so much better. So being a centralised model seems to have helped. And if we can get consistency across the board, then it's certainly on an upward trajectory, isn't it? That's all I wanted to say, really. Nothing in depth.
Thank you very much. That's very helpful. Any other similarly helpful points? Okay. Councillor Harris, Roger.
Thank you, Chair. On page 50, 10 of the page 50 of the bundle, 10 of the report. Adult services, NSIs and PAMs. What's a PAM? What's an NSI?
Oh, Councillor Harris, apologies. We are guilty of officer jargon.
All the time, all you officers.
within the national performance framework, which is sort of set by Welsh Government, there are 3 levels of information. The top level, NSIs, or National Strategic Indicators, are measures which we're obliged to produce by law, effectively. The second are public accountability measures, which we must put in the public domain, but which are not a legal requirement. And the third level, which I don't think are in this report, are called the Service Improvement Data Set, and they're information which all local authorities produce in a consistent way, but which are not shared publicly. So yeah, apologies for the junk. Actually, probably we don't necessarily need to put that in there at all. I think it's been in there for probably officer reference rather than the member, just to make sure we tick them off and get into the reports all the ones which we are obliged to put out there.
Just on that one, on SCA 019, the 214-15 Q1 figures aren't available. I just wonder, surely they should be by now.
Yeah, so it's this one. Interestingly, the reason they're not available is probably in terms of that particular measure and its usefulness to that team in managing that service. It's not one of their key measures, and this is some of the things we find sometimes with the measures in the national framework. They can sometimes be almost compromises which are easy to collect across 22 local authorities, but which are not necessarily giving the team the information they need to run services and to manage the risk around these people. So we've taken a look at that. The team have a database which they use to evaluate this on a daily and weekly basis. But actually, it's not something which can be easily condensed into a single number performance indicator. The one thing I can say around that, because subsequent prior to this, some work had been happening, because on the reported performance, it wasn't where it needed to be last year. I think 81.2%. We were below the Wales average. A piece of work has been undertaken looking at that, and actually some of that we think is down to recording, the how we record when a risk has been managed or reduced. And what we'd expect to see next time that figure comes before committee is actually a significant improvement on that performance of 81.2%.
Could I just, I know you all want to go, but I'll just pick up a couple of things. Can I first of all acknowledge the timeliness of this? And on page 7, for example, in head of service comments, Julie places this in context and includes a reference to yesterday's seminar. I think that's excellent and timely. But a bit further up on those particular pages, page 5, I think it is, but the same place appears somewhere else. Are there any causes for concern about particular establishments or not? I mean, Gibraltar House is mentioned, for example. Are there any issues that we should be aware of? And yet I seem to recall somewhere else it says, well, maybe we don't. Which is it? Is it all right or isn't it?
I'm happy to answer that, Chair. Is that okay?
Yeah, please.
In reference to what we would call provider performance issues, there are at any one time a number of providers who potentially are in, if you like, are on our radar through either provider performance or through escalating concerns. And currently, a number of providers are in provider performance, and a couple are in escalating concerns, and GCV is one of those that is in escalating concerns. So obviously, those are the processes that we go through, and those are, and we will be continuing to report that as this scorecard develops.
Good. Thank you very much. That's helpful. And if an issue of this sort is persistent, then committee might want to consider it in some appropriate way. And I say appropriate because I realise that not everything can be talked about in the same way, and some things might require different. For example, we looked at some issues at a recent meeting whereby some information was available at the time of the meeting, other information was made available later because it simply wasn't, to hand. We might need to find ways of handling some of these issues. But if there are concerns, I think this goes back to maybe what we were saying earlier about alerts and knowing if there are issues that we need to be aware of as members. I am pleased to note, however, that these things are clearly on officers' radar and being addressed, and that's also what we want to hear. So, are we just about at the end of our questions for Margaret now? Thank you very much indeed. So, we've thanked you for coming. We've thanked you for the report, and we are going to have to look again at how we sequence these things. And you've sort of offered to help us with that, which we appreciate. That we never live in a perfect world. But we keep trying, and that's great. Next item on our agenda for the committee is just to make sure we know where we are with our work programme. Hazel, would you like to... Now, this is a new style of presentation,
Yes,
isn't it?
I'm not going to procrastinate with this item,
Can I
Chair.
thank you very much as you go. Thank you, Julie. Thank you, Matthew. If you want to go, thank you very much, Margaret. Thank you very much, Anne. Thank you, Tracy. Thank you, Simon.
Chair, I'm not going to procrastinate over this item because I'm aware that some members have got another committee starting in 15 minutes, now 10 minutes. So just to quickly update you on the work programme, your next meeting will feature budget scrutiny. The mandates are listed there for you. And then your January meeting will be challenge of the risk assessment. That will be the meeting at which you can call in cabinet members with responsibility for certain risks that fall under your portfolio. And at that meeting, you can really challenge them on whether they are mitigating the risks to your satisfaction. Another meeting that you'll notice on the 17th of February, we've confirmed attendance by Judith Paget and Bobby Bolt from an Iron Bevan Health Board to discuss minor injuries, integrated care priorities for last days of life. And as mentioned in the pre-meeting, I believe they want to add to that agenda their annual report. Items from there on are not yet confirmed. They're subject to confirmation. I hope everybody finds the new style of work programme a little bit easier to follow. It's been replicated across all the selects, so happy to take feedback on that, but nothing else to add, Chair.
To sum up then, obviously we've covered a fair amount of ground today. I was pleased that we were able to combine looking at adult select issues and a common interest with children and young people. It's been an agenda where, in some ways coincidentally, papers have been of a similar kind, and we've been engaging stuff, some of which is new, but some of which isn't so new. But we've had some very encouraging things said here today, particularly about the underpinning work with Gwent Frailty. We've been reassured about the way children's services in the particular regard are coming out of a period of difficulty and hopefully on an upward curve. And we're going to look again, as best we can, at some of the sequencing and timing of the various reports, and also to see whether we can include in some way some of the other issues, because I'm very struck by some common themes this morning which are nothing to do actually specifically with the directorate that we're particularly concerned with here. The common thread is about members feeling from time to time that they're not sufficiently in the loop, and that goes all the way from not perhaps, in spite of everything, being in the loop about the seminar yesterday, and I'm sorry that happened, not necessarily being in the loop about issues emerging in our wards. And it's unfortunate that people have come to that feeling, if I could put it that way, but it is fortunate that people feel that it's entirely appropriate to raise their concerns through this particular medium of this particular committee. I don't want us to become a kind of whinging and moaning thing. We are making good progress in all sorts of ways, but we've got a lot to do to make sure that our act is as good as it can be. So thank you for your time, your patience, and is this our last meeting before Christmas?
No, Chair. You've got your budget meeting, which is going to be a very heavy meeting.
Which is on the when? I'm just thinking about when I got to buy the mince pies. That's okay. Okay. Thank you all very much indeed.
I've got to go. I've got to go.
Yeah, of course you have. Of course you have.
Nick, sorry, I've lost the phone.